Hello and welcome to the 2023-24 open enrollment. Of course, you're enrolling now, but your new benefits will go into effect for 2024. So we are in the meeting for Temple Beth Hillel. This is being recorded so that you can look at it later. Maybe you missed this meeting, or maybe there were some questions that you didn't get the opportunity to ask because maybe you missed the meeting or something like that. So we're recording it for you. So without further ado, you should be able to actually see my screen right now. And we have a test employee. You don't have any fellow colleagues by the name of Chuck Test. So we're going to go with Chuck Test for this year. And of course, we're here with Leslie and Chuck and myself, Jonathan. So we're going to start this meeting now and just go through, a typical enrollment. What we have set up on the screen right now is actually a version of the portal, okay? And actually, let me click this for you so that you can see it the way that you're actually going to see it on the screen. So last week, we actually sent out to all the employees the login for the portal. Pretty much every employee has seen the login already. It's the same one that we used for last year, and you got a brand new link this year. So that is your personal link to go into the portal and to make your benefit changes. This is your time to go ahead and make any updates that you need to do. Of course, if you were just making an address update or a change to your last name, those are the types of things that you can do all year long. But this is actually the time where you can choose the plan that you want for the next year. So since the rates can go up on the plans, and that means that your payroll deductions might change, it's always a good idea to come look at the portal. There are a lot of people that come back, a month or two after open enrollment is finished, and they might come into Leslie's office and say, hey, my payroll deduction changed for this, and what's going on? A good way to eliminate some of that is to take a quick look at the portal. And even if you love the plan that you had last year, right, this is a good idea to, make sure that nothing major is going on with your plan. So that's why we do these meetings, to make sure that, once again, most of those questions get answered.
Yes, I just wanted to say too that, or just remind folks that during this open enrollment time, this is the time to make changes, to see what the new rates are, because rates change every year. So if you can talk a little bit about that too, Jonathan. I also want to let staff know that that I will be, once open enrollment closes out, I will then be reaching out to each individual staff person that has enrolled, just to reconfirm their enrollments, because sometimes people can get confused. They sign up for something that they didn't want, or don't realize that there's an actual premium impact for their payroll deductions. So I also want to make sure that staff is aware that that I will be reaching out to them individually to reconfirm their enrollments, and also I'll be providing PAN forms for folks to review and sign off on the benefits that they've enrolled in. So Jonathan, can you just reiterate what open enrollment is? And because I do get some people to ask if they can make changes in the middle of the year. So can you talk about what open enrollment is and when changes can happen?
Yeah, so this is our time period. So everything that's going on for the next year is actually happening right now. I wish that we could let people make changes throughout the year, but this is actually the carrier's guideline. They give us a certain window to go ahead and make changes and get you into a new plan. So as much as, I may like you, or Leslie likes you, or the Temple likes you, it's really the carrier that doesn't allow us to make changes after this window gets closed. So this is really important that you choose and pick the right plan for you for the next year. A lot of times people are concerned about, well, what if I have a pre-existing condition? What if I'm pregnant now? Are they not going to let me move, from Kaiser to Anthem or vice versa? Most of that stuff is all accomplishable. There really are no pre-existing condition rules. Pregnancy is the one thing where they try and make sure that if you're going to make any changes, you do that before the 25th week or something like that, because that's just a doctor rule. That's not actually a carrier rule. And other than that, once again, if you have an upcoming surgery or something like that, that's going to happen in February, and you think you might want a better plan, absolutely take it right now. It does not matter what one of your fellow employees does this year. You can choose the plan that makes the most sense for you. Maybe last year you went with the Vivity plan and you're like, oh, I want to go with Kaiser this year. That's great. No problem whatsoever. Make the change that best benefits you. That is what we're trying to accomplish here. Because once this window closes, that's it. The only other time that something can happen throughout the year is if you have what's called a QE or qualifying, a QLE, qualifying life event. That is not a style of card. QLE is actually qualifying life event. So if that happens, and let's say you get married and you want to bring your spouse onto the plan, you can absolutely do that. Let's say that your spouse loses coverage and they need to come on the plan. Those are all the types of things that can actually be done, throughout the year. But of course, when that person does come onto your plan, you cannot change your plan. You're just adding them to your plan. So that's very important. And that's why doing some planning right now can save you a lot of energy in the future.
Thank you.
So right now, let me just make sure. If we're looking at my screen, you should see the profile. Is that what we're looking at? Okay.
Yeah.
So one thing, we had a meeting earlier today with another client, and the funniest thing, I guess we skipped over the fact that when you go to your portal, the first thing you need to do is hit start enrollment. If you don't hit start enrollment, it's actually not going to take you to the open enrollment tab. So a lot of people were going into their portal during the meeting and saying, oh, I can't see anything. So you have to do that. And then it actually starts the process for you. The other thing that it triggers for us is it actually lets us know that you've started. So if Leslie wants to take a head count and she's like, okay, 10 people have started benefits, we know who you are. I mean, we're not going to stop by your house, but we know who you are. And so it's a good way of us knowing that people are actually doing what they need to do in the system. So after you do that, you should come to your profile. The reason why we set up this process in the first place is because in the old days, when you filled out forms, you had to fill them out over and over again. This system kept a record of all your information, right? And so the nice thing about all of that is that all of your information should be in there. So the only thing that might not be in the system is if you need to update your address, or what if you have a dependent that you want to consider for benefits this year that maybe you did not put in there last time. You are going to want to enter them in this step, right? So that you can see what the price is going to be for their benefits. So I filled out the fake profile here for 121 Main Street anywhere in the state of Alabama, even though it's in the county of Los Angeles, but I think it works. And so we hit continue, right? It takes us to dependents. If we wanted to add somebody, we just click here, add dependent. Now that person does not become automatically enrolled in benefits. It will just show, that person will just show up so we can see what the cost is. So don't worry about that person being there. If you don't want them to be on benefits, you just click waive in one of the next steps. One thing that's been going on for the past few years, you used to do this on paper, but last year we made a change where you acknowledge the SBCs. We updated that for 2024. So when you go into your portal, if you have not done that yet for this year, this is a step that has to be done for you to be able to complete the process. It will actually tell you at the end if you have not done this and not allow you to finish.
Jonathan, can you explain what that is? What's an SBC?
Sure. So a while back during healthcare reform, you have all seen a summary at some point in your life, but during healthcare reform, during Obama's administration, they wanted to have a unified document and the SBC stands for Summary of Benefits and Coverage. It's a blue and white document that's supposed to be familiar no matter who you're getting your benefits from. So whether your spouse has benefits in another company, they all see a similar document to this one. So it is a very unified structure with the deductible, out of pocket, all of that. And it's not just enough sometimes to put it in the portal. It's actually a very good thing that you acknowledge that you've looked at some of these documents. What you'll even notice is Kaiser has their own that forces you to do theirs as well as this document. And that's because they believe so strongly that you should take a look at the out-of-pocket, the deductible. And so it's really just one of those things you click on and do. The one that we have you sign, you'll just sign it on the screen and it'll go into a file in the computer so that we know that you've seen it and received everything.
And that gives folks a clear breakdown of all of the deductibles and what that specific plan, the benefits of that particular plan and what the deductibles are.
Absolutely. So because it's kind of a unified document across every carrier, everything's in the same spot. So if you're looking for what the deductible is, or if there's a prescription deductible, right, because maybe you want to plan with better prescription coverage this year, you can go right to that feature. And it doesn't have every single thing on that document, because if you were looking for something that you think might end up in an exclusion or something like that, you're really looking for an evidence of coverage, which is like a 1,000-page document. This SBC is the most commonly asked terms, and there are explanations off to the right on every SBC. So these usually come in a 3 or 4 page format for each carrier. Okay. So they do get updated every year. So it's not going to be the same SBC as what you had last year. There's actually a brand new one. And obviously that's going to be because, maybe the deductible changed a little bit, or the out of pocket, which is a very typical thing for the insurance company to raise, because healthcare is getting more expensive. Mm-hmm. Not just in premium, but going to the hospital, things like that get more expensive over time. So I like referring to it. If there's something not on there and you want to go over it with us, definitely reach out to us, because we can go look in another document to find it if for some reason you don't see it there. Right now, what you see on the screen, it does show something for Medicare. That's only if you happen to have Medicare. If not, you can continue. It's not going to stop you from finishing the process. Some people might be of Medicare age and they're deciding, what they're going to do. So we have you add that in there just so we kind of know what's going on. Okay. So when I hit continue, what you'll see is this is our old video for last year. After this video is done, we are going to replace it so that when you log in, you will see our new video there, and it'll look very similar to this one, but it will be updated for 2024.
Jonathan, when will you be able to update it? I told folks tomorrow, but is that a realistic goal? Or
Absolutely.
Oh, okay.
It's a very easy process.
Okay.
To get the video translated so that we can put it there. We have to post it on our YouTube site for the business. Mm-hmm. And then we go ahead and we put it here, because that's how the links work for the video.
Okay. And in general, can you tell us if there are any changes to the plans that TBH is offering in general, and then just talk a little bit about the changes in premium rates.
Yeah, so each plan is a little bit different. There's quite a few plans. So off the top of my head, I'll pull up a comparison. What I like about looking at the comparison is it highlights the plan that somebody would have had last year, right? Mm-hmm. And it allows you to compare right away all the other plans. So that's going to highlight some of the differences right away. Okay. But I think what would be a great idea is for anybody that's curious, like, hey, did my plan change dramatically? We can work with them. When we sent out the invites for all of this, we sent our Calendly link, and that allows employees to, schedule time with us in 15 minutes duration so that we can get to everybody. And then that way we could go, one-on-one with that plan. If somebody's concerned, like, hey, this is what I'm thinking about doing. Am I going to be hit harder with prescriptions? Is my hospitalization more expensive? Certainly, every carrier has their own approach to what they do for, the next year. And it has been a whole year. It's been an entire year. And the
Mhm.
insurance companies have actually been playing and toying around with their plans all throughout the year. But we're just seeing those changes now, while other groups that might have enrolled later, they've already seen some of those changes.
Okay.
So when we go and we click on, Chuck Test right here, and let's say we want to hit compare plans, we can go and we can see. Now, I did not choose a plan for last year under Chuck Test. That's why you don't see one. But normally in this section is the plan that you chose, the very first plan. Um,
Okay.
and then an employee can actually go down to the bottom and they can export this whole thing to Excel if they want to have fun. I think during Thanksgiving time, um, going over some of this insurance information is the most fun that you will ever have.
But that'll
Uh,
give folks a different visual to see what the plans are, to be able to look at them and compare them, compare the deductibles and the co-pays and so on.
Absolutely, because I think sometimes these things can change depending on who you're going to have on the plan with you. I think a lot of these choices are very easy if it's just you as the employee. But the minute that, let's say that somebody is pregnant, and there's going to be, what you have to think about that most people don't think about is, oh, wait a minute. Okay, we're going into this plan in January. And I think, maybe I'm thinking about getting pregnant in January. That means the baby will be born in 2024. And so that means the plan that you choose could be important because now you have a premium for that child, right? And benefits that you have to account for. So sometimes people are like, oh, I don't really think about it. And we went out to a huge meeting for a trucking company last week, and somebody ended up in the emergency room for a lack of vitamin D, which would have been caught at the preventative care visit. But guess what? They didn't go to the preventative care visit. And then so this is what typically happens. And then somebody ends up in the emergency room. Then she ended up being admitted overnight, and she was young. She was only 34 years old. So when things like that happen to very young people, it's always because, hey, maybe they missed some of these, visits. And so when I talk about some of the benefits every year, because all of these plans have one benefit in common, no matter what you do, and that's the preventative care benefit. It's always no charge. It doesn't matter what plan you choose, you get preventative care. And just as a reminder, preventative care is a little bit different depending on how old you are. If you're young and you're, in your 20s, it might just be the annual physical, which is just blood work and cholesterol and some of those items. But as you get older and get into your 40s, that's where you get the PSA testing, the mammograms start to come up, right? And then you get into your 50s and they do the colonoscopy. All of that stuff is covered at 100%, right? The only difference with the colonoscopy is that sometimes if they have to do some surgery that comes up, then it becomes diagnostic, right? And at that point, they do charge you a little bit because that's technically outpatient surgery. But it's just good to know that all of these items are part of your plan. And I actually say, you're pretty much being charged for these things already. So you should do them, right? Why not take advantage?
Mhm.
And a lot of people say, okay, well, I want to go tomorrow and get my annual physical. But the one thing to keep in mind is for most doctors' offices, they're treating people on an emergency kind of need first. Somebody saying, I'm very sick, something like this. So, okay, come in today. But for an annual physical, they were usually set that appointment out 3 to 4 weeks. So do some planning. If you didn't do anything at all with your, annual physical last year, then that means you could probably go and get this annual physical, in January and start the new year off right and kind of know what's going on.
And just going back to your example of someone getting pregnant and then end up having the child in 2024. I just want to reiterate to staff that if that's the case, then there's a whole process for that, and it's very easy to add the child on to to your plan that you're currently enrolled in, because obviously we're going to know that you're going out on leave, and there's all the personnel paperwork that goes along with just taking the leave. So that's something that staff can work with me on, individually, and we can make sure that the newborn child gets added on to the plan if that's what the employee decides to do.
Right. That would be a great example of a QLE, a qualifying life event.
Yes.
Is not a Toyota Camry model. And sounds like it though, right? When that happens, just let us know. It's great to get to Leslie, let her know what's going on. You can reach out to us as well. It's just we kind of need to know within 30 to 60 days what's happening when it comes to qualifying life events, because the carrier only allows you to respond within that window. If you're 6 months out and you're like, oh, I forgot to add my spouse, my child to the coverage, it's going to be very difficult. Not to mention, if the carrier even went back and did that there would be all this retro premium that you would have to pay because they were trying to get this fixed for you. So it's just a great idea just to keep that in mind. 30 to 60 days. Let us know what's going on.
Yes, thank you.
So one of the things that I think people were probably wondering is what was the approach to this year's renewal. And, when everybody sat down, the administration decided that we were going to keep, Anthem and Kaiser. So you still have those options. So if you're listening now and maybe you're, driving around while listening, to this video that we've put together, is you'll be happy to know that we still have Anthem and Kaiser. So we don't have any major changes like that, right? But once again, you may have to decide where you're going to go with your Kaiser or your Anthem plans. Most of how your benefits are structured is we have a base plan, and off of the base plan is how all the premiums are determined for all the employees in the plan. So you should keep that in mind as well. And what you're seeing on my screen is not a joke. There are some plans that have no premium, and that's amazing, right? And that just goes to the strength of your employer and how much they are actually contributing to these plans. Because I got to be honest with you, there aren't as many employers out there in the world doing this anymore, right? So when you look at this and you see plans where you're paying little or no premiums, this means that you can get coverage for yourself and not have to worry, right, about having a premium that you can't afford. Not to mention that one of the most successful things that your employer did last year was bring in Anthem as your other provider. I know that we had another carrier in for a few years, but the reason why Anthem was so successful is the Vivity plans, right? There's select HMO plans and there's Vivity plans. And the one up on the screen here, the Vivity HMO 25, right? The Vivity refers to a network, and that's a network of doctors. The network of doctors in Vivity is primarily focused on UCLA, Cedars, and Providence. Many of the people that work for the temple live in the surrounding areas, and these are the doctors that they wanted to see the most. Don't forget that UCLA and Cedars are probably the most expensive providers in Southern California, right? So when people are in the general area and they're saying, oh, those are who I wanted to see, well, now you have the Anthem Vivity plan, and you don't have to have a doubt in your mind about having an affordable plan to get to those providers.
Now, do I have access to those providers on the Anthem the Anthem Select, or is it only the Vivity plans that I have access to, those teaching hospitals that you mentioned?
Right. So Vivity is centered around those particular providers. And remember, you used to have to get PPOs and all these expensive HMOs to get to those providers, but you're getting them on Anthem Vivity, right? When you go to Select HMO, that's really all the other providers. So if you're looking for Regal Medical Group or Lakeside, you're going to find that in Select HMO. That's not going to be in Vivity. But if you said, okay, I want to go to, Providence, St. Joseph's, or you're saying, oh, I want to go to UCLA UCLA or Cedars. And of course, there's that brand new Cedars Providence facility, in Tarzana that they redone. You have access to all of that, right? And it's a very unique plan. Everybody tried it last year and had, some great success. Once again, it is an HMO. So just remember, you are picking a primary care doctor when you go on Vivity HMO, or if you're going on the Select HMO, you're picking a primary care provider. Everybody did that, when they previously signed up. So we're not going to change any of that, even if you switch your plan here. So if you go with a different Vivity plan, we are not changing your primary care doctor. We are just changing the plan. Okay.
So if an employee signs up for one of the HMO plans, whether it's Anthem Vivity or Select, Anthem Select, if whether they want to keep their current primary care physician or if they want a new one, what is that process? Does the portal automatically send folks to Anthem's website so that they can get the because there's a primary care physician number
Yes.
that folks need to enter onto the portal when they're signing up for an HMO plan.
Absolutely. So couple different things to keep in mind here, since we're going through open enrollment. If you're keeping the same plan, but you really just want to change your primary care doctor, that didn't even have to be done at this time. You actually get the opportunity to do that every month. So as long as you call, Anthem and give them a reasonable amount of time, I usually say call them before the 15th of the month, they will change your primary care doctor to a new one for the following month. And you can do that all year round. So if you are flipping back and forth between UCLA and Cedars or Providence, that's not a problem. You can do all of that. Same thing if you're on the Select HMO, if you're, trying to find a new provider, in that medical group. Now, because this is open enrollment, right? I would say if you just want to change your provider, I would call Anthem directly to do that. I would not use the system to change your provider. It'll be much faster, and they have an actual concierge to help you, right, at Anthem to get you over to these new providers. So I would actually use that first for those changes. Now, if you, let's say, are on Kaiser and you're coming to Anthem for the first time, for example, then yes, absolutely put in the provider and the provider number. And what we have is, we have this provider search tool that I'm kind of circling around on the screen right now. When you hit this button, it'll take you directly to the Blue Cross website. And when you do that, it's
You
going
mean
to
the Anthem? Oh yeah, Anthem Blue Cross. Okay.
yes, yes.
Okay.
It is Anthem Blue Cross. And actually it has another name as well, but we'll keep it as Anthem Blue Cross. But this will take you there. And what you want to make sure of when you go to search for these providers, because we are dealing with two different networks, is you either want to use Vivity as the network or you want to use Select HMO as the network. That's the differentiator, because if you actually look for UCLA in the Select network, it will not be there and it will do you no good. So we have the links in here, as well as, the SBC is in there. So there's a whole lot of good information and resources. But if you're stuck on this, once again, I would just say pick up the phone or shoot us an email. When we sent out the link, our email is actually linked onto that as well. So as Leslie, so it's all there. You can definitely, find us. And so if you get stuck, don't hesitate, because I feel like a lot of people think they're bothering us, but we live and breathe insurance. I sometimes have nightmares about insurance when I, go to bed, and then I wake up and I realize, insurance all the time over here. So keep that in mind. Now, on the other hand, if you're with Anthem and now you're thinking about going to Kaiser, right? Well, you're not picking a primary care doctor when you go to Kaiser. Kaiser's facility-based. So if you're going to go to a Kaiser facility, you just need to choose that at the time that you're going to access care. So if you live closer to Pacoima or Panorama City, there is a brand new Kaiser facility out there. But if you're in Woodland Hills, there's the Kaiser facility off of DeSoto. So you have plenty of different choices just depending on, where you live. Sometimes Kaiser will have a specialty that is in the city off of Sunset. They do some of the brain work and neurology work over there. So they may send you over there if they don't have the specialty in the Valley. But if you were going in and you were having a baby and you want to deliver, at the one off of DeSoto, No problem. All of your resources will be there in, one spot at the Kaiser facility.
Okay.
Okay. So once you make your selection for this year, let's say I want to do this here. I go and select that. There isn't a premium. If I put in a dependent, there might have been a premium. And as you can see, there are plenty of plans that you can choose from, because there's not just the Vivity HMO, the Select HMO, there's also Anthem PPOs and Kaiser HMO. So there are plenty of choices depending on what you want to do. Now, let me just answer a question, and I'm sure that's going to come up. Somebody would say, well, why would I want to go on the PPO rather than the Anthem Vivity HMO? And, usually that's a personal choice. PPOs have a lot of freedom. They allow you to go to any doctor in or out of the network, whereas an HMO, you really only have in-network privileges. So you're going to in-network providers. So if you didn't want to have a primary care physician and you wanted to go see Jim Smith on Monday and you want to go see John Smith on Wednesday, that's something that you can do with the PPO that you cannot do with the HMO, because on the PPO, you're not even worried about the medical groups. You do want them to be an Anthem provider, because going to see in-network providers will always be a better deal for you. They have a contract with that provider. But if you needed to see an out-of-network specialist, you could absolutely do that under the PPO, and you would just go. I would just warn you, though, talk to them first to see what some of their fees might be, because you might be shocked when you get the bill later, because they may charge something different than a contractor provider would. Okay. So this is the space down below. If you are putting in a PCP, we can also auto assign a provider if this is your first time, and that'll just let us know, hey, just have the carrier pick somebody for us, and they will actually pick somebody that's close to where you live. That's typically how they choose providers when they do an auto assign.
And again, you can always change your primary care physician, and they do it on a monthly type situation, right? So it would be an effect the first of the month for the next month.
Yes. So as long as you get to them very quickly, I always say before the 15th, that gives them enough time to get to the new provider and say, hey, they want you to now be their primary care doctor. Most of the time, this is because there's a list that actually goes over to the new provider and lets them know, hey, now you're on here. Now you're on the list. You can go ahead and utilize these providers and this medical group for, all of your care.
Okay.
Don't forget that, once again, Anthem Vivity is pretty unique. There are some things that other plans simply do not allow that Anthem Vivity does allow. And one of those is if you want to ask for a referral, and let's say you're with UCLA, but you want to see a Cedars provider, that is something that they can do for you. And they do not do that on any other medical plan that is out there. So if you are struggling with something and you think that you need to get a second opinion or something from this other provider, that is something that the Anthem concierge for Vivity can help you with. But of course, once again, if you get stuck, you can reach out to us as well.
Great.
Okay, so safe to move on to the dental, vision, and the other products?
Yes.